Hi, I'm Simon Ellis. I'm a knee surgeon. I've been a consultant knee surgeon for the last 23 years in Kent. I work here at the One Ashford and I'm very lucky to do so. Talking about knee arthritis, it's often a question that patients ask. Knee arthritic symptoms tend to come on gradually, so it's not typical of symptoms following an injury. And often we find that patients come along with an MRI scan where their GP says, I've got a meniscal tear and that needs to be sorted, but often it's part of a degenerative process. The symptoms typically are gradually getting worse with time. Patients find that they've got increasing pain, often increasing stiffness and swelling, and struggle to use the knee normally. So starting to walk more slowly and starting to have limitation of walking distance. One of the worst symptoms is when the knee pain wakes you at night. In terms of making a clear diagnosis, often it's clinical. The knee may be noisy, have limited movements, and sometimes it starts to go out of alignment. But the best test of all is an X-ray, just the plain, simple, normal X-ray, which clearly shows evidence of arthritis. In terms of treating arthritis, it really depends on how bad your symptoms are. Treatment can vary from doing nothing, taking simple painkillers, and in fact, things like paracetamol, just one tablet 4 times a day, can make a dramatic difference. Ibuprofen is very helpful, but if you're a little bit older, it's not really ideal because it doesn't interact terribly well with blood pressure pills, and it's not great for your kidneys if you're perhaps getting a little older. After that, we look at things like regular exercise, low impact exercise, things where the knee isn't impacted. So using a cross trainer, front and back crawl swimming, cycling are all great for your knee. Following that, we look at physio. For a lot of people, physio makes a great difference, but if you're already exercising, you probably don't need to go and have physio as well. Then we come on to injection treatment, and there are all sorts of injections, including steroid injections, which are short term, hyaluronic acid injections, which can give people relief for perhaps 6 months, or some of the more modern injections, such as platelet-rich plasma, which can give relief for over a year. Finally, we're looking at realigning the joint if it's out of alignment, or joint replacement if it's really bad enough. But we have to think of that as a last resort. End-stride injection is a form of platelet-rich plasma. What it does is it takes your own blood, we use a centrifuge to get part of the blood and then inject it back into the knee. The injection is very simple. It's done as an outpatient. You come in, you lie down, you have your blood taken. We take it away, we put it in a centrifuge which spins it down, and then we extract the platelet-rich plasma. Having done that, it then goes back into another centrifuge device with some crystals which release activated proteins from the platelet-rich plasma, and then we inject that back into the knee. So in all, it takes about half an hour. You come and lie down, relax, and I come back and inject the knee at the end of it. Patients who've had it done tell me that they've really had fantastic outcomes. It was originally developed in conjunction with the vets, and it's been used in animals. And as we all know, if animals have a painful joint, they won't use it to walk. And interestingly, animals seem to walk much better after end-stride injection for a very long time. Published material. End-stride is part of platelet-rich plasma that's extracted from your own blood. The advantage of using your own blood is the fact that it doesn't have any other factors that you might be allergic to. Having taken the blood and taken a tiny fraction of that blood, we extract proteins from it. Very simple technique. And those proteins work inside the knee to stimulate the autoimmune, in other words, your own treating yourself, if you like, system inside the joint. And there's evidence that the proteins that are released stimulate cartilage regeneration. Cartilage we're talking about is hyaline cartilage, the joint surface cartilage, rather than the meniscus which footballers tear when they're young. So the joint surface cartilage that wears away is stimulated by these proteins we all have in our own blood to regenerate and so improve both pain, but most importantly, function. And it's shown to be acting for a very long time. Some of the papers clearly show this gives ongoing, really good effects 2 years after the injection, whereas all other injection treatment lasts anything from 3 months to really at most a year, and we're injecting chemicals. In terms of accessing treatment, I do a weekly clinic here at the One Ashford every Thursday afternoon. I only see patients with knee problems as I'm a pure knee specialist, and we can discuss whatever needs to be done, anything through from appropriate physiotherapy referral. Often, physiotherapy is enough to settle things down. Clearly, if you need surgery or any form of injection treatment, we can organise that here too. To get in touch, all you need to do is to ring the One Ashford Hospital and ask for me. They'll be able to direct you to make an appointment, and I'd be happy to see you.